It is now 12 o'clock and we're going to go ahead and get started. I am Helen Hockey, Executive Director of PCOH, and we are so glad you have joined us today. This is our 5th year of offering virtual meetings, and in most years we understand it's pretty difficult to make it to all of our in-person meetings, and particularly in this year, it's very difficult to make it to any kind of meeting. So we're really happy to offer these brief updates semi-annually for our coalition stakeholders. As always, this meeting will be recorded and shared on our YouTube channel, so you can feel free to share the link with others, either in your organization or outside of your organization after today. So just some quick housekeeping as we get started. All lines have been muted by us to keep the background noise to a minimum. You may type any questions that you have into the Q&A box, which should be located at the bottom of your screen at any time during the presentation. Sometimes we're able to grab the questions as they come in, but if not, we'll make sure that we leave some time at the end for any Q&A. For those who are joining by computer, you will have the opportunity to participate in some polls that we'll put up periodically throughout the presentation. And then for those who are joining by phone, and who are unable to see slides right now, I definitely encourage you to go back and review the video at a later time. We'll send the link out for the presentation directly to everyone who has registered for this event. And then we'll also send you a copy of the slides by themselves so that anything we talk about that has a clickable active link, you'll be able to do that from your home computer. So thanks again for joining us. Let's go ahead and get started. So to start us off this afternoon, I would like to invite our board chairperson, Dr. Deborah Polk, to say a few words of welcome to everyone. Dr. Polk?
Hello. On behalf of the board, I would like to welcome everybody to our stakeholder meeting today. Thank you so much for joining us, particularly in this sort of challenging year. We really appreciate all of your ongoing support. And that you make PCOH a priority and a part of what you are doing. So thank you. And I hope going forward that we will be able to see you in person sometime in the coming year.
As we all do. For those that know me well, I'm an extrovert to the max. And so this has been a particularly challenging year for me personally. So thank you so much, Dr. Polk, for that welcome. As we get started, I do want to do our first quick poll just to get an idea of who's with us today. It's going to just simply ask if you've attended a PCOH meeting or function before. It gives us a good idea of sort of who's in the room. And so if you're able to be joined by a computer and able to answer the poll, you can go ahead and do that now. It should be up on your screen. We're still a fairly young organization, so we're always growing our stakeholder list, and we want to make sure that when we have new folks in the room, we're giving a little bit of background on sort of our history as well. So we'll give you another second on the poll, and thanks to Amy who's working all the magic on the back end here. And let's go ahead and see our results. Let's see. So we are mostly about 80% of you have attended a PCOH meeting before, but we do have a handful of individuals that this is their first meeting. So welcome. We're really, really happy that you're here, and we hope you find this webinar informative and helpful to your work. For some of you that have been participating with PCOH for a while, the first few slides are going to seem a little familiar and a little redundant. But I do want to make sure we give some background on the coalition for any of those of you who are new on the line. So we'll go ahead and close that. As you can see, when we are looking at our board members here, I did want to just share that so that everybody is aware of the diversity of our board. We've got some really great backgrounds, and we continue to rely on our board for the direction of the coalition. So I did want to just take a minute to say thank you to all of them for hanging in there in a really crazy year. And then we're going to talk a little bit about our staff. We've got some staff listed there as well. Looking at our next slide here. So I want to take a minute to talk a little bit about what PCOH is and what we do. Many states have developed oral health coalitions over the last 20 years, some even longer. And the role of oral health coalitions is not necessarily centered on a certain type of health provider or a specific policy goal, but it's more of a broad spectrum kind of collection of groups and individuals who are passionate about oral health. And we help them share ideas and work together. We also play a role in initiating new projects and programs ourselves from time to time, as those opportunities become available. Pennsylvania is part of the American Network of Oral Health Coalitions, which is a national network of similar groups. Our coalition formalized in 2013 with the addition of staff, as well as a more formal board structure. We're a registered nonprofit, and we rely on grants and donations to complete the bulk of our work. So in just the last 7 years, we've grown to nearly 900 stakeholders across the state and 3 full-time staff. We can actually announce today, here first, that we'll have an additional part-time staff person joining us on Monday. Angela Renner will be joining PCOH as our program coordinator and comes to us from a diverse background in chronic disease prevention and promotion through public programming and health plan interventions. So we are really thrilled to have her join our team for 2021, and I hope you're all going to welcome her to the oral health community. We'll send some more information out about Angela in the next few weeks. So with every staff person and every stakeholder that we add, their background helps to contribute to our reach and knowledge base. For that, we're really grateful. The connections that we're able to make around the state mean that no one really has to recreate the wheel, and we can all learn from each other on a consistent basis. So we're very fortunate to have a lot of support from many corporate and community funders. PCOH, as I mentioned, is a registered nonprofit, 501c3. We are happy to report that 85% of our funds raised in 2019 went directly to programs and program administration, both that we provide directly or through our partners and subcontractors. So while many of our regular activities have had to change this year, the impact that we have made and continue to make remains significant. During the COVID-19 pandemic, funding for advocacy and education nonprofits like ours is rapidly shrinking. Though many of our programs use federal and community grants, we also rely heavily on our corporate and organizational funders and our individual funders to keep us moving on a variety of projects. So most of our funders have been providing annual support for many years, and we really, really couldn't do it without them. This includes, of course, the big names you see on the slide, but it also includes all of the individuals who contribute annually during our appeals. You can see that list in our annual report that we publish after the first of the year. And we would encourage everyone to visit our website, where you can actually click directly on our funders' web links and learn more about them. On behalf of the board and the staff of PCOH, we do sincerely, from the bottom of our hearts, sincerely thank everyone who's contributed to our work, both this year during such a crazy time, but also to all of our past donors who've helped build us to the strong coalition we are today. If you're interested in learning more about organizational sponsorship or making a personal donation, of course, we're always happy to discuss that with you at your convenience. So when we look at the main focus areas of the coalition, and of course, many of you are familiar with our priorities, we're going to put up a second poll here because we'd love to hear a little bit more from the people that are here today as to where your work focuses on our priorities. So we look at oral workforce, we look at community water fluoridation, serving the underserved, and then of course putting oral health into policy. So I'd love if you guys have a second to go ahead and fill out the poll that we've got up there. As we move forward with our discussion of the 2020 work we've completed so far and the goals we have for 21, I want to point out that some of these items will include work that's done more internally by PCOH staff and board, but nearly all of our work is collaborative. So we work to improve oral health in the state, and we want everyone to know the most recent updates for the work going on. So, if you hear of something that interests you, let us know. We'd love to help with anything that you're doing around oral health. And likewise, if you're able to share resources, check in with a staff member and let us know what you're working on, or even actively join a task force or a work group. We're always interested in building our group and our work effort. So looks like we've got the poll up pretty well here. I saw just another one coming in. So we'll go ahead and see the results here. When we look at this, as usual, improving oral health for Pennsylvania's most vulnerable populations is typically the thing that most people see an overlap with. But then we've also got some strong work in policy and development there, and workforce development as well. And about 17% also said community water fluoridation. So thank you guys so much. It helps to give us a little bit of background of where you're all coming from. So let's reflect on 2020. I don't think I need to tell anyone what this year has been like for all of us, right? Little bit of a crazy time and what I like to call the dumpster fire. I've heard the term dumpster fire used more this year than I think cumulatively I've ever heard it used. And while I couldn't agree more that we've had a lot of tragedy and challenges, I really can't help but see the silver linings. We've seen people learning more and more about public health and paying more attention to the importance of, whole body health or whole system health. So that's really good news for our dental needs. It helps to break down those silos that we've sort of seen built into the system over the last 150 years. So we're going to talk a little bit about the good in 2020 today and not focus so much on the dumpster fire. So on your screen now, you're seeing the front page of a short document that we developed recently and sent to many of our stakeholders that we have physical addresses for. And to tell you the truth, I was really kind of shocked myself when we put the numbers together to see our reach during this year. Didn't quite think it was going to be where it was. We're grateful for all of our partners and programs that we work with because we were able to really switch things up a bit and reinvent the ways that we accomplish our work. If you haven't seen this document, the picture will be linked to it, so you can download it after the slides when you receive them after today's meeting. And we're going to talk about most of the different topic areas on here today. So if you have any further questions on this work, of course, you can always ask. But here's the back of that document with some more of our numbers. So you can see, I think we're going to probably touch on most of these things today as we go through the work we've done. And I also wanted to share a mask shot. So I think a lot of you have probably been able to get one of our really cute masks that say, "I'm smiling under here." We sent those to our stakeholders that we have physical addresses for. And we're happy to ensure that any donor between now and December 31st, of course, will also get one if you haven't already. And just let us know if it's something you want. We can probably arrange to get you one. So we're going to dig into some of our priorities and the work that we've been doing in 2020. So oral health workforce is where we'll start. It continues to be a major focus area for our work. We have a lot of people who turn to our website for updated info, and we're happy to share that all of that extra time in the office this year allowed us to launch a refresh of our current website this fall, as well as a completely revamped course portal. So the picture on the screen is of our portal shown here that has a link directly to it if you haven't checked it out yet. We added 2 new courses this year. Our Count Me In session is one that complements our special needs training and focuses on encouraging dental providers to see patients with disabilities. We were thrilled to work with our partners at Achieva, the ARC of Greater Pittsburgh, and their Disability Health Initiative on this program. It's a super brief course that provides a half credit of continuing education free of charge. And there's additional courses available on the portal to get more free credits on treating those with disabilities. The second course that we added, which we were fortunate to work with the Erie County Department of Health and the Tobacco Free Northwest PA program, is a specialized training for dental providers to learn more about tobacco and nicotine cessation counseling. It complements the state's general course, which is called Every Smoker Every Time. And when you take both of those courses, you can get 2 free continuing education credits for dental providers through our website. We've got a number of evaluation points as part of that training that we're going to be tracking around for the next few years. We want to see more and more people referred to the online QuitLogic site and to the phone in quit line from their dental provider. And we're also going to be watching to see how many dental providers are billing for tobacco cessation counseling over the next few years. So for those who may not be aware, Our state did approve in August of 2019 that Medicaid will reimburse dental providers for the 1320 code, which is for tobacco and nicotine cessation counseling. So moving on to some other workforce concerns for us and opportunities for projects. We really do try to look at the dental pipeline in our state. So when we're looking at underserved and rural communities, we know that some of these areas just don't have enough providers. So in order to accomplish some of this work, we try to reach dental and dental hygiene students to encourage them to pursue careers in public health. Through our state's HRSA Oral Health Grant, PCOH is able to use Mary Otto's book called Teeth to discuss various public health careers and the history of dentistry with these dental students and dental hygiene students. Since September of 2018, when we started this project, which is just a little over 2 years ago, even if it seems like a decade, we are happy to report that we've now worked with over 70 faculty members at the dental schools and dental hygiene programs, as well as 659 students, which is really, really exciting to us. It's been an amazing, tremendous program to do, and really being able to connect with the students has been great. Our collected data so far demonstrates that we have a higher percentage of those students that we've talked with and met with that are now more likely to work in public health. So that makes us very happy. We'll be continuing that program for the next 2 years and look forward to it reaching even more students. So we did move to a virtual model for this year, but as you all know, everyone's getting pretty comfortable with Zoom, and it's been a pretty seamless transition. So if we look deeper into our dental workforce pipeline, so we're talking prior to college, we begin to talk a little bit about high school students. We know that if we want someone to serve in a rural area, it's best if maybe they call that rural area home, rather than trying to entice someone from out of the area to practice there. So in the last few years, we have started to work with a group in our state, the Health Occupation Students of America, or HOSA, which has about a dozen oral health programs in Pennsylvania. The HOSA oral health programs have been a little bit more difficult, of course, to reach in light of COVID, with conferences being canceled and schools moving remote, but we were able to send out some materials through their advisors. But we also wanted to do a little bit more this year. So in order to increase our high school reach in rural and underserved areas, we launched a new guidance counselor project this summer and identified the counties and school districts that actually had the highest number of dental health professional shortage areas. And we sent them some informational packets that they can share with students that would include, a copy of Teeth, the book by Mary Otto, a map of all the dental health professional shortage areas, the list of the schools that offer dental programs and dental hygiene programs, and then a dental careers pathway document, which you can see a brief little piece of here on the slide. We really wanted people who maybe weren't considering dentistry as a career to start thinking that way. And we want to make sure that we're filling all the spaces in dentistry. So, from a dental assistant who works chairside with the doctor, to a specialist who's performing oral surgery. We want to make sure we're filling all of those gaps in our dental workforce. So if anyone in your day-to-day work has a use for the dental careers pathway document or any of the other documents I mentioned, please just let us know. Oftentimes we can cover the cost of printing for these items and get them out to you right away. So if you work with different groups from a career perspective, we're really, really happy to help share that information and hopefully increase interest in dental careers. So lastly, when we're still looking at oral health workforce, we do want to consider the numbers directly from the State Board of Dentistry. We're seeing a general slight overall decrease in the number of dentists, in the number of dentists and dental hygienists over the last 6 years, which is good news, the increase. Our odd years always show a little bit of a dip, since that's when licenses are renewed. So we tend to have retired providers who choose not to renew show up on these data. For our expanded functions dental assistants and public health dental hygiene practitioners, we're seeing a steeper increase there. Those numbers are rising a little higher or faster than the RDH and the dentist numbers. So this is all good news. But we know that HRSA reports Pennsylvania still needs almost 300 new dentists in specific regions just to address the current shortages. We're also very concerned that COVID is going to have some long-term impacts on dentists choosing to retire early or practice less hours, or that we may see hygienists and assistants leaving the field altogether. So we're going to be monitoring renewals in March to see what kind of dip we see there, because that's when everybody will be set to renew their certifications and licenses. We did have some great public health workforce news yesterday that I want to share with you all if you haven't heard. As many of you know, our state has public health dental hygiene practitioners that work without dentists in public health settings and refer patients to regular and comprehensive dental care. They can provide preventive treatment out in the field in a public health setting and help patients to understand the importance of treating their disease, which then helps navigate them to a dental home. The State Board of Dentistry has been deliberating the additional practice settings for PhDHPs over the last few years, and a final step was taken yesterday to add medical offices in underserved areas as well as child care settings to the allowable practice settings. So the Independent Regulatory Review Commission voted to approve the final reg changes yesterday morning, and those should be published as final in the PA Bulletin sometime in January or February. So that's really great news for those of us, who have seen the benefits of introducing dental providers into the medical side and seeing some more integration in our care. So moving on to our next priority, our work in community water fluoridation is mostly centered around a few areas here. We work on a lot of sort of grant programs. This year, we were able to use some additional CDC state grant funds to provide over $150,000 in equipment replacement funds that will ensure 7 communities in our state will guarantee optimally fluoridated water to their customers for the next 5 years. We've got some additional grant dollars available for systems that want to initiate fluoridation. So if you know of a water system that might be considering adding fluoride, please let us know ASAP and we can provide some information. And even if you would love to have some help or work on our community water fluoridation task force to talk with your community about initiating, we're happy to help with that as well. So the next bullet point deals with our rollbacks. Rollbacks are what we call it when a system is currently fluoridating but considering removing their fluoridation system. So this year we had some continuation of rollbacks that started back in 2019, and we were able to work with those communities that had task forces in place. Though PCOH tends to provide a lot of technical and resource support, we really have to acknowledge that it's really the fantastic local advocates who battle these rollbacks. And this year we had some all-stars in Mechanicsburg and Corryville that just did a fabulous job. So we're really fortunate to have some super passionate and competent folks who believe in these initiatives. We were also able to work with the State Department of Health on a communications campaign. It highlighted the 75th anniversary of community water fluoridation through a variety of internet ads and postcards and resources and flyers that we were able to distribute to family physicians, WIC offices, and pediatricians in the state. Counties that have had rollbacks or threatened rollbacks over the last few years were the ones targeted, and we're documenting, of course, the overall reach of the campaign. We're also really pleased to announce that the Department of Health Oral Health Program has published a state fluoridation plan that's available on their website and ours. So you'll be able to see when you get the slides, you can click right to it and read through that program. And then lastly, talking about the communication that we have with water operators and water associations, we traditionally attend 3 or 4 of those conferences every year, which of course were canceled this year. And so we did a little bit of replacement for those communications through some advertising in their journals and publications. And we've been really promoting a specific CDC training called FLOW that's specifically geared for water operators around community water fluoridation. So if you need any more information on that, please let us know. And then wanted to show, we've got some data here if you're a data nerd like so many of us are. and you really want to know exact numbers for fluoridation, data tracking and surveillance around community water fluoridation is so important. And sometimes it's a little bit of a hurdle to jump through, we'll say. So we've got our latest analysis here of the most recent Pennsylvania data, which I credit mostly to Mary Lynn here at PCOH. She's really an expert in analyzing and understanding the infrastructure of our community water systems. And so our most recent numbers here show two critical statistics. When we talk about individuals who receive optimally fluoridated water, we look at two populations. The first is the total population of the state. And for us, that's 12.8 million people. And then we look at the areas of the state where people get their water from public water systems. So this statistic excludes households who are served by wells. So in 2020, we're estimating that nearly 56% of people who get water from a public water system are receiving the benefit of fluoride-adjusted water. The second statistic that you see in yellow there, the 49.35%, really looks at the total population of the state and includes everyone in the state. So including the 1.5 million people who receive water from a well, we divide that out, and that's where we get the number of nearly 50% for the total population of the state is receiving fluoridated water. So regardless of how we calculate it, Pennsylvania really still remains in the bottom 10 of our 50 states when ranked in population receiving fluoridated water. Our neighbor just to the south, Maryland, has over 93% of their population served by public water systems receiving fluoridated water. So what that means is we've got a really long way to go, but I hope that all of the stakeholders that we have, everyone on this call and everyone you work with, can help us promote the benefits of fluoridation, within your own communities and your organizations. So our last piece of fluoride work this year that I wanted to touch on is a completed mapping project that was finished this summer with some help from a student intern at Mercyhurst. We were able to generate some GIS maps that, everything that you see, we've got our county lines drawn out in red on the map here. The green areas would be the non-fluoridated water systems, and the blue areas, for good water, show the water systems that are currently adjusting fluoride. And so when you see the parts of the state where there aren't blue or green, those would be the areas that maybe aren't serviced by a community water system or public water system. So we have a lot of rural areas in our state where people get their water from a well. So this map is available on our website. Our goal is we've been working really closely with the Pitt Water Collaboratory on an information brief and publishing a kind of usable map, clickable GIS map of the water systems, so that anyone from the general public could go in and build in the layers of this map. So you would be able to click in, zero in on your county, your area, and see who gets fluoride and who doesn't. So we'll have some optional layers on that map as well, so that you're able to apply school district lines, legislative district lines, et cetera, and really sort of use that for advocacy and information for your communities. So we're really excited about that and hoping sometime after the first of the year that we'll have that clickable interactive map available online. So our next priority area focuses on improving access to quality dental care for underserved populations in the state. We're under-resourced. We have a variety of reasons that people don't get to care, and so we look at a lot of that. Looking at this map, please don't get overwhelmed. We working our way through the issues, and we've really come to realize, and the data proves that only about a quarter of our general dentists participate in the state's medical assistance program, which is Medicaid. We have more than 3 million adults and children right now who are relying on Medicaid in some form for their health insurance or health coverage, but we lack a large number of options when it comes to finding a dental provider, particularly, for patients with specific conditions or, patients who reside in certain areas of the state. So in order to identify the high need areas of our state where providers are lacking, PCOH requested a full list of practice site locations for Medicaid dental providers. We've generated an interactive Google map that, we'll be publishing soon that allows a breakdown of these layers for the various specialties. This work was completed with another Mercyhurst intern, Alyssa, who's actually going to be eventually going on to dental school at LECOM. So we're thrilled to work with her, and she did a really great job. So we took the data and we removed duplicate practice sites and mapped all of the entries. So to be clear, each provider may not be listed on this map. For example, if there's 20 doctors that work at one location, or at least registered at that location, only one of those names will come up. So it removes sort of that overconfidence level of, sites could have 40 or 50 dentists registered as a provider at that specific location, but maybe only 4 or 5 of those dentists work there regularly. So the link on this map will be live for you to explore the data yourselves once you receive the slides. Looks very busy now, but each specialty is overlaid on this map picture. So this is every dentist, every specialty. So then when you are clicking on that, you'll actually be able to, I have a screenshot here of the, hey, I think it went the wrong, there we go. So when you look at this screenshot, you'll see that on the left-hand side, there are actually different squares you can toggle on and off. So on this one that you're seeing here, we've toggled off every provider except pediatric dentists. So all of the purple stars are pediatric dentists who are registered with Medicaid by practice site location, okay? So then next, if you want to actually zero in, and we've got some areas where we're able to do that. So if I come to, a circle here and we decide that we can circle on this guy here, I'm just gonna put a little line over it so you guys can see what I'm talking about there. And I click on that, what's actually going to come up is a link that demonstrates who that practice or that provider is. So when I click on that one that I highlighted, it comes up as Dr. Coffer, and I'm going to pick on her because she is a great stakeholder for us, and I know she won't mind if we pick on her. So, and it will give the address where she is listed or the practice location. So again, it's not necessarily meant to assist, say, patients with finding dental care directly, but the map really is more intended to help us as advocates identify high need areas and specialties. So when we look at this map and we see that the entire northern tier of our state is pretty severely lacking in pediatric dentists that accept Medicaid. So that's really, really important to us. And I will point out that, as with any data source, there are always, errors and omissions and issues. So if you see an area where you say, hey, wait, I know that there's a pediatric practice up in that northern tier that's not on here, we can always adjust that as we get more information. So our hope is that we'll just continue to update this map and improve it on a regular basis moving forward. So lastly, on the priority, for this priority, we've had a number of projects this year that, we've sort of continued from previous years. We're assisting the State Department of Health with their state school sealant programs. We've got 8 or 9 state programs now on board, when we hope to reach more than 60 schools this year, even in spite of the pandemic. It's our goal. It may be a lofty one, but we know that when we talk with our providers who are actually trying to get into the schools, they are so incredibly passionate about doing it, and they really do want to get in and help these kids this year. So we'll continue to monitor that through the rest of the school year. We continue to work to identify potential rural health clinics who can either start dental services or add additional services. We've got some small equipment grants available for that through a project funded by HRSA. So if you work with any rural health clinics in your area and, they may be interested in adding some dental services, please reach out and let us know. Under teledentistry, of course, we were one of the first groups to sort of do some teledentistry pilots back in 2016. And right now we're working through our HRSA grant with a partnership between the Erie County Health Department and Head Start to see those kids up in the northwest corner of the state and connect them with a dental home. So that project will be continuing for the next 2 years as well. And then we continue to hold our regularly scheduled calls with managed care organizations in our state, since those are the ones who provide the health coverage to everyone on Medicaid, specifically around, tracking data, making improvements for special populations. So, when we start looking at pregnant moms or, those with disabilities or extremely young or vulnerable children, we want to make sure that we're working together with the health plans to sort of identify those highest needs. So that continues. And of course, all of these programs rely on our media outreach as well. So we are definitely always interested in sharing that information out through media. So our last priority area focuses on policy support and implementing oral health into really all policies in the state. The most obvious way, of course, to do this is through legislation. So I did want to give a little bit of a recap of the Pennsylvania oral health focus bills that we dealt with this year. HR 799 was a bill that we kind of co-wrote with Achieva and Representatives Innamorato and Gatos. We wanted to look at the cuts to Medicaid benefits for adults that took place back in 2011. It did not make it out of committee this year, but it did get some attention. So what we have seen sort of as, what I would say sort of after this bill kind of didn't get anywhere was the chairman of the House Health Committee, Representative Kathy Rapp, introduced a bill late in the session, HR 1051, which was a resolution called Boosting Oral Health Care in Rural Communities. So what that actually calls for is to look at 3 different things. The bill calls for a review of the benefits of teledentistry. It also looks at mobile dentistry and how that functions in our state, and then calls for a cost-benefit analysis of increasing oral care to those living in rural communities. So we were able to talk with Chairman Rapp about the bill about a month or so ago, and she has assured us that she has interest in bringing it back next session. So we're really hopeful that we'll see that move and start to focus even more on oral health care through the legislature. The next bill, HB 2108, I just wanted to mention, it's really about the extension of postpartum coverage for Medicaid. So pregnancy-related Medicaid eligibility ends right now at 60 days postpartum. Now, should specify this is pre-pandemic. There are some special provisions right now through a maintenance of effort clause that are allowing people to hang on to their coverage a little bit longer. But typically 60 days postpartum is when pregnancy-related Medicaid eligibility ends. So as such, we get a lot of people who are left without coverage really at a critical health time. So there have been a lot of efforts, and we work with a couple different groups who actually work on this. And we want to extend Medicaid coverage for those individuals up to a full year postpartum. So from an oral health perspective, it really would be the best thing because you're really connecting that mom with a dental home up until the time when her child would be due for their first dental visit. So very, very important, that 1 year mark for dental. And then lastly, the last bill on here, just wanted to touch base on was House Bill 2645, which was teledentistry legislation, which, in Pennsylvania, teledentistry isn't really officially, regulated or not regulated, but this bill would actually put it down on paper. So it would, ensure that the State Board of Dentistry had provisions for it, and also establish insurance coverage for the services. So it's important to point out that a lot of teledentistry is already covered by insurances, but this would just sort of mandate it across the board. So again, we'll be tracking these to see if they come back next session, and, we'll keep everybody posted. And I did want to mention, I already mentioned the PHDHP changes that came out through the Regulatory Review Commission yesterday, but that, of course, was also a policy area that we were following pretty closely this year. So in terms of other ways, we do serve, staff all serve on different committees across the state. we try to make sure that if there is a health-focused committee or work group, that we're there to talk about oral health as part of it. So I'm not going to read all of these, but these are just a variety of the different groups that we've served on, over the last year or two or three, that really focus on health, and we're able to bring oral health into those conversations. So it's pretty great stuff. And really this year we've had staff at almost 100% of all of the meetings of all of these groups. So we continue to see more and more interest in that. I should mention right now the Pennsylvania State Health Assessment is in draft form and is out for public comment until Monday. So if, you can Google search the State Health Assessment, or I can add the link when we get the notes out to everybody. But if you're interested in seeing sort of what our state's looking like as a whole, you will see some mentioning of oral health within that plan, which is great. And so one of the other things, of course, as we work on infrastructure and surveillance, which isn't necessarily a priority area of PCOH, but it is a really important part of the work we do. So I wanted to take a second just to talk a little bit about that and some of the data that we have. For most of us here at PCOH, I would say we're probably the most proud that our state was able to publish a new 10-year state oral health plan this summer. So the link to that is there on the slide. You'll be able to click to it if you haven't seen it yet. The plan focuses on three main priorities, one being access, prevention, and education, the next being workforce, and the third being infrastructure. Within that plan, we've got 22 measurable objectives that we're going to be looking to improve upon. And there's an opportunity right now, if any of you are interested in helping sort of shape the direction of the priorities and how the plan gets accomplished. The state oral health program has open nominations right now for the oral health plan advisory group. So anyone who would love to serve on that, we can let you know right away. If you didn't get the email this morning, I know we sent out a reminder email this morning. So if it's not something you've gotten, please let us know and we'll get you connected right away with the state oral health program. We always, of course, continue to advocate for increased funding around oral health. And we've got two different programs that we were working on specifically this year. Our charitable work tracking project survey is something we started back in 2018, 2019. And we wanted to start gathering data on how many people were receiving care free of charge through free dental clinics or charitable dental clinics. And so we were able to, late this fall, put out our 2019 survey collection information. And we're still putting some of the numbers, but I will tell you that we found in 2019 that 8,400 people received free or charitable care through either pop-up clinics or year-round free clinics, things like that. And they received almost 40,000 procedures. Totaling, a value of $6.3 million. So we know that, we have a lot of people still relying on free and charitable care for their dental care, which in our minds means that we have a problem with access. So I think it's really important to talk about that. One of the things that I have found is that, we know that people are willing to provide free dental care. But there was a quote on a DentaQuest video that I saw about a couple weeks ago. They had a really great quote, and Marsha Beatty from Oklahoma was interviewed. And one of the things she said is, we're not going to volunteer ourselves out of this dental crisis. And it really touched me because I thought, that's exactly it. Like, we can't rely on pop-up dental clinics to provide comprehensive oral health care. So I think it's really, really important that we see that sort of moving forward in a way that we're not just, putting the Band-Aid on, that we're actually repairing the system. So kind of along those lines, our other project we worked on this year was a dental access project. We really wanted to look and do an environmental scan of the state and find out how people find and access dental providers. So we were able to do a survey directly to individuals and began working with a variety of organizations and databases to sort of determine what the options were for a centralized location for this information. So I will say that, we ended up working most closely, I think, with the United Way's 211 program. And I'm sure most of you are familiar with that, but it's a statewide program that just seems to make the most sense. They're able to gather resources. I believe they said this week they have this is resources in general, but 77,000 resources on the Pennsylvania United Way 211 database. So people call that number or reach out online for a variety of reasons, and they're in the middle of sort of revamping, all of those things. So we were able to give them some additional dental resources. We don't have all of our final numbers yet, but we know that just in the last 2 months, they've nearly doubled the amount of dental resources available through their website and through the call-in line. So we're really, really hopeful if you're a provider yourself or you work for an organization that provides dental care for those that, would be considered underserved, please do make sure the link here that's on this site is for providers to register and become a resource in the 211 database. So we'd love for everybody to click there and fill that out. It's really quick and easy. They even send you annual reminders to update, so you don't have to think too much about it. So just a couple quick slides I wanted to show since data isn't always readily available. And some of you have seen some of these numbers before. The state does a behavioral risk factor survey every year, and every other year they collect information on specific oral health questions. So when we look at adults having a dental visit in the last year, we've seen that number, a slight decline, but really it's stayed pretty stagnant, we'll say, between 66% and 72% over the last 16 years. So not a lot of swing there, but what it does show is that only 2/3 of our adults in the state are getting to the dentist, which, obviously is not a good number. And then the other data slide you'll see here is the percentage of women who reported having their teeth cleaned during pregnancy. And that number, again, has really stayed fairly steady between 48 and 54%. So again, if we want to generalize that and say half of women who are pregnant are getting their teeth cleaned, we want to see that number go up. We know how important that is. So, these are the numbers that sort of shape where we shift our priorities in our programs and projects. Now, the next slide here is, in my mind, a really amazing success story. So these, just to kind of explain what you're looking at, these are kids under 21 who are enrolled in Medicaid coverage. And the dark blue lines are actually showing how many went in for a preventive dental visit in the last year, whereas the light blue lines are showing if they had any dental visit in the last year. So as you can see, that number has gone up steadily over the last 20 years. And we just recently saw in our 2019 data that we did for any dental visit, we hit 50% in 2019. So seems kind of crazy that that's a success because of course you would hope that for kids who have dental coverage, we'd see more than half of them going to the dentist on an annual basis. But that actually is a pretty amazing success and surpassed the goals that our state actually set in the State Health Improvement Plan. So super exciting there, and we're glad to at least have hit that 50 mark. This year may prove to make it a little bit more difficult. With COVID, it's of course been hard for everyone to get in for their regular health visits. But I keep saying I think 2020 data will just be omitted from everything we look at because it's just going to be all over the place. So, and I did just want to mention again, I know I mentioned our state oral health plan. Of course, there'll be a live link to this. Again, if you haven't seen it, please check it out. Please, find your part in the plan and help to contribute to set up all these things that we want to accomplish over the next 10 years. It's really, really important stuff. So lastly, I just want to spend a couple minutes talking a little bit about some of our upcoming work in 2021. And again, if you have more questions, I'm going to go over it briefly, but if you have any more questions or you want to know more information, just let us know. We had to postpone our third grade basic screening survey, which is a quick screening that we do in a sample size of the third graders across the state. Pennsylvania has never done one, but we have funding from a CDC grant to do that. And we're hoping to implement that in the 21-22 school year, which will give us an idea of the percentage of third graders who have had decay, and also the urgency of their treatment referrals. So, we'll be able to know if there were urgent needs or just mostly routine needs in those kids. PCOH is applying for a rural outreach services grant that would start next year if it's awarded. We'd like to co-locate a dental provider in a rural hospital, and, working with a local FQHC as well. So we are super hopeful for that, and we'll keep you guys posted. We're going to be holding a dental leadership meeting in February, which will be focused on gathering professional organizations who focus on dentistry, and sort of having a meeting of the minds so that we can, get some perspective on where public health should be heading in Pennsylvania from dental leadership and dental schools. The next thing is working with the American Dental Association's Health Policy Institute. They are working on putting together a proposal for us to look at our workforce in the state, not just from a perspective of who we have, but who will we have. We want to make sure that we're projecting our workforce and we know where our holes are going to be. We're also working with a student from Simmons University who we're hoping to implement an implicit bias survey for dental providers and use that information to, maybe do some specialized targeted education and find out which populations maybe aren't getting the services done that they need. So a couple of potential student projects. If anyone knows of any undergrad or graduate students, we always have, a couple data projects, a couple report projects that if somebody knows of someone who's looking for something, we're happy to match up. We've got, I think, 2 students that are currently lined up to be into 2021 right now. And then, of course, our community water fluoridation work will continue. We're hoping to get a comprehensive list of all of the equipment needs for the water systems that fluoridate in the state. So that's part of our work effort for next year. And if you haven't heard, in January and February, we're going to be doing a series of listening sessions with our partners at Achieva to learn and listen to dental providers and about why they do or why they don't see patients with disabilities. And then I mentioned some of our career info for the pipeline programs. We're going to be doing some more specific work directly with the area health education centers and targeting some high school students specifically around choosing dental career paths. So, along with all of our current projects with HRSA and CDC that we're already working on, these are some sort of extra additional things that will be happening next year. So please, if you see anything that's interesting, let us know. We'll be glad to have your help. We just wanted to add some resources here so that you have these. If you need anything, probably between these sites, you'd find anything you needed to know about oral public health. And then, of course, have to mention that our online calendar, of course, stays updated. We're not anticipating a lot of in-person meetings next year, but, we are still keeping up with all of the webinars and virtual meetings that are happening. If you want to get involved in one of our work groups or task forces, please, of course, feel free to reach out. We're always looking for more people, and even if you're just looking for a local group, we do keep a list of all the local and regional groups that are working on oral health in different areas of the state. Our PCOH board will be looking to bring on some board members, particularly with focus in, legal backgrounds or financial HR backgrounds. So if you know of anyone, that you work with or that might be interested, let us know. And we're still saying save the date for our next statewide oral health summit, which hopefully will take place in November of 21. We're really, really hoping. And now I'm going to pause there. And I know we had some questions that came up here. So I want to make sure, let me see here. So we did have a question come up. looking at teledentistry other than, outreach through phone, different technologies that can be used. I will say, we're seeing teledentistry being authorized both from, an audio only perspective and a video perspective. And there have been a significant number of waivers that have sort of said, that maybe you can use Zoom, maybe it's not HIPAA compliant, but, they're really relaxing a lot of those orders right now. But there are specific companies, and I really can't give you them off the top of my head, but I have them saved, and we can get that information out to all of those things. So, if you want to reach out to us privately to ask, I can set you up with some of the resources for the companies that do it. They'll set it up for you. They'll house it all for you. And it's not that expensive. So it's definitely something that can be done. And I know I see Dr. Greenberg asked here about ANOC, the American Network of Oral Health Coalitions, if they have meetings. So it's an interesting group. Because it's a membership organization. So we do have, there are regular meetings of ANOC. They haven't done any public facing meetings quite yet, but that's a really interesting idea. So I actually serve on that board. So Dr. Greenberg, I'm going to take that back to them because we really haven't done that yet. We've really done everything internal. So it might be a really good idea to open it up wider than that. I will say that most of the people who are involved in the American Network of Oral Health Coalitions are also heavily involved in that open network and DentaQuest partnership. So if you're attending the DentaQuest partnership and the open meetings, you're getting all of the information that the people from ANOC are focusing on. So are there any other questions there? If you have, I think the other thing we wanted to do just very quickly in the last minute or two is wanted to ask if anybody, if we could put up our last poll here. So many people are getting really burnt out on Zoom meetings and calls, and I know you guys are all drowning in it. But if nothing changes and we're still kind of stuck where we're at right now, we would just love to hear from you. So you'll see the poll up on your screen now. We'd love to hear from you how you would prefer we connect, specifically even in the next 6 months. We've seen a decline in some of our registrations and things because we know people are just tired of being on the computer. And so we want to make sure we're connecting with people in the way that serves them best. So I'll give you another couple seconds here. If you have some time to connect with the poll here, we'll see, because we love talking to people, and it's always okay to pick up the phone and call us or shoot us a quick email. Sometimes that really is the best way, and all of our staff are willing to have those conversations. So it looks like Amy has closed the poll and is now sharing the results. Looks like informal and formal meetings are really taking up about 2/3 of the vote. Which we did a variety of this year. So, we can continue that moving forward, and some of you are preferring, of course, social media, and fingers crossed for in-person, of course, takes some numbers as well. That's where I'm heading. Those fingers crossed for in-person meetings is really the most important. So we will go ahead and close that down. I know we just have a minute or two left, but were there any other questions? Did anybody have any questions? You can type into the QA or the chat box and we will see them. Okay, everyone. Well, hearing none, I'll give you about 60 seconds back in your day, and I very much appreciate you taking some time to listen to our updates today. Stay tuned for an email to come around with the link and information. And I really hope you all stay very healthy and safe through the rest of this year. Do your best, everyone. That's what we're doing.